symptom is you probably have an acute febrile illness, which is actually a fever. You look like a normal fever, alright? Nauseous, alright? Vomiting and diarrhea. And all these signs and symptoms are the same with dengue.
That is why
And that is why
it is very difficult
and that is why it is very difficult to compare either you have a leptospirosis or you have a dengue. Alright?
and very often
And very often we go for a dengue checkup because it's more common in Malaysia instead of leptospirosis. But they didn't know, alright, that leptospirosis is actually growing in our community. Alright, and the number 3 that I would like to highlight is the treatment. Right. If let's say you get a normal mild.
come sound more excited.
Okay. Okay, if let's say you have a normal
A patient
a patient got a mild lepto, which is we call it aneuploidy, which is most
eye contact this side too.
and which is okay, which is most of the patient who have a leptospirosis is almost like 90%, right?
According to research
Yeah, according to research,
by Dr. Tony Stark,
Dr. Tony Stark, right?
published in the Lancet Journal,
Published in the Lancet Journal,
December 2005.
December 2005, that 90% of a lepto patient is a mild or aneuploidy patient, which is they can be cured by a normal antibiotic, which is also called by doxycycline, right? And only 10% of the lepto patient, right, they really got a really acute one, which is normally we all know by what failure of organs inside their body, right?
Leading to
Yep, and also they normally the one, the acute one is going to be in the ICU and only lasts for about 1 to 2 weeks.
leading to fatality.
Yes, which is leading to fatality. And the way to treat them.
This means
And this means.
if properly diagnosed,
This means if we could properly diagnose.
9 out of 10
9 out of 10
patients
patient could survive and have a proper treatment before they went for any acute or fatality.
that is why proper diagnosis
That is why proper diagnosis kit
is important.
is important in all our hospitals. Alright. So the conclusion is out of all this, alright, I would like to tell you that I would like to urge all of you.
Hey, where's the 1, 2, 3?
Yeah. Huh? 1, 2, 3. Oh, that's really again.
Yeah.
Oh. Alright, so all of these 3 causes, alright, these 3
So I would like to remind you
I would like to remind you
of the 3
the
elements
3 elements
of leptospirosis.
Of leptospirosis is the cause,
1,
which is 1 is the cause, which is the, and second is the sign and symptom, and third one is how you treat them. Alright? So the conclusion of this, I would like to urge all of you, okay, that people should be aware and always know where is the source of your food. Alright? At least we could just see if the place is really clean. Alright? And secondly, I would like to people to know that if there's any sign or symptom on you're having a fever or something like that, check for lepto and also for dengue. Because a normal clinic or whatsoever in Malaysia, they are just going to give you Panadol and antibiotic.
so please insist
So please insist
that you are checked
you are checked
for both.
for both dengue and lepto, and ask them to send to the hospital. Alright? And avoid, I really urge all of you to avoid self-treating yourself by normal home medicine or by a normal like old pass, like the one that the doctor gave you before, an antibiotic to finish it or whatsoever, because it may result in the hospital may have a very difficult time to check you got a lepto or a dengue because of the antibiotic act in your body and take a longer time for the hospital to find what you have, right? Because 75% of the doctor's result, 75% of doctor's treatment is based on laboratory result. Okay, so you can't say that the doctors are good
according to research
according to research,
by the Institute of Health,
Institute of Medical Research,
Ah.
Malaysia, right? That all the doctors' result based on that from the lab. They are not to say that they are not good, but what the lab report, they start to treat on what the lab report, right? So I would love for all of you to remember my conclusion, and I urge you guys to make sure where your food come from, right? And please